Well, good afternoon. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Registered Nurse Education Program webinar. Before we begin, I would like to discuss a few housekeeping items. First off, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen. For instance, if you need to change the view to see the content, you can click on Focus on Content. You can also find the chat bar and enter in your chat messages in the pop-up that comes up from there. Number two, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Today, the chat option will be open for asking questions during the presentation, and we will answer them during our Q&A session, which is at the end of this webinar. And then lastly, all of the resources for today's presentation, including the slide deck that we will use, are linked in the chat box now, and they will be pinned into the chat. All the resources can also be found on our website, hcai.ca.gov. And with that, I am thrilled to introduce Crystal Flores, Program Officer for Song Brown.
Hi, my name is Crystal. I'm the RN Program Officer, and today we're going to be going over the RN application and highlights from that. We're going to focus on the items that are scored, and we're not going to go step by step in detail, but you're going to want to have the TA guide open as you start your application because it does have page by page, step by step in detail there. Okay, next slide. Okay, so RN is one of over 10 programs under Song Brown. Some are longstanding, like family nurse practitioner, physician assistant, primary care residency, as well as our registered nurse program. And there are some newer programs as well related to FNP PA postgraduate fellowship and midwifery. And Song Brown provides financial incentives to programs to graduate individuals who practice in medically underserved areas, enroll members of underrepresented groups in medicine to the program, locate their program's main training site in a medically underserved area, and operate a main training site at which the majority of patients are Medi-Cal recipients. Next slide. Please refer here to the review and application deadline. If you submit your application by the early submission review date, we will provide feedback and you will have 5 days to correct any errors. And if you submit after the early submission deadline, you will not be eligible for early review and will not be able to make corrections after you submit your application. Please see the RN grant guide for more information on the early review process. Next slide. Before you apply, if your program requires approval to contract from a coordinating authority, please inform the authority of the terms and conditions contained in the grant agreement. Your applicants must agree to the terms and conditions before receiving any funds. HCAI cannot make changes to the terms and conditions within the grant agreement, and funds cannot supplant existing state or local funds. Next slide. There are some changes for 2023. The biggest change is the addition of the expansion award opportunity. Existing and expansion award opportunities exist this year with up to $27.4 million in funding available. The maximum award of $900,000 is per eligible existing pre-licensure RN program, and that's up to 30 student slots, $15,000 per slot per year for a 2-year award. And the maximum award of $600,000 per eligible expanding pre-licensure RN program, up to 10 student slots, $30,000 per slot each year for a 2-year award. We've also removed the attrition rate and the NCLEX pass rate questions from the program data page. And this cycle scoring criteria was added for expanding programs, and minor scoring changes occurred for existing programs. And you can see the RN grant guide and scoring guide for more information on that. Next slide. Information that you'll need to gather. Please start collecting the signatory, training site, student, and graduate information listed here for your application now. You don't want to wait to collect this information. It can be a time-consuming process, especially if this is your first time completing the RN application. Please make sure that you have the correct BRN approval letters. If you are applying for both an existing and an expansion award, we will need 2 approval letters, one for your existing slots and one for your expansion slots. Next slide. Here's the link to eApp, as well as a link to RN resources on the Song Brown webpage that you'll need to review for your application. We post all the important program updates to the Song Brown webpage. Please keep your eye out for future updates. Next slide. So this part of the TA guide goes into registration, but as most programs have registered for eApp, we're not going to cover registration in detail today. But if this is your first time applying, please refer to the TA guide for step-by-step registration instructions. If you're an existing program and you've undergone staff changes since last cycle, please contact immediately through songbrown@hcai.ca.gov. Okay, and so now we're going to skip ahead to slide 18. Slide 17, where it says apply here. There you go. Okay, so after the program director completes registration, they must click on the 2023 Cycle RN program link on the eApp homepage under Apply Here. At the bottom of the pop-up, click the Apply button. Those with the program director access will see the Apply button. Next slide. Before we jump into initiating an application, we'll just cover a few tips on the eApp system. Next slide. Some useful information includes how to navigate the application. You're going to want to use the previous and the save and next buttons found at the bottom of the page to go back and forth on your application. And the eApp saves your application each time that you click save and next. And you can navigate to the applications in progress/submitted tab to resume your application. Next slide. There are red asterisks, and those are required fields. So you'll need to enter data into those fields before the system will let you navigate further to a few subsequent pages. And you'll also want to look for the tooltips, the little blue buttons with the question mark, because those are going to contain additional information about the fields there. Next slide. So now we'll highlight the most important steps for completing the application. Like I said before, we're not going to be able to go step by step in detail. We're just going to focus on the steps critical for scoring. So you'll want to refer to your TA guide for full instructions. Okay, next slide. So the first application page is the program information page. You'll notice that in addition to identifying your program type, ADN, BSN, ELM, you have to identify if your program is expanding. And it's critical that you make the correct selection here, because the wrong selection will send you down the wrong application path, and it may impact your score or prevent you from receiving an award. Next slide. Please follow the steps here to select an existing training program name if you applied last cycle. Otherwise, the import feature will not run. Next slide. Please follow the steps here to enter a new training program if your program has never applied in a prior RN cycle. This includes verifying the program address in HCAI using the search function here. If the address you're entering doesn't return any search results, you can email us at songbrown@hcai.ca.gov and we can walk you through it. Next slide. The next application page is the contract administration page. It's critical that you confirm with your financial or contracts office the exact organization name and the DBA as applicable, used for tax reporting purposes. It has to be exactly matched, as well as the authorized signatory information for each signatory role. Missing or inaccurate data here will delay agreements. Next slide. The legal address entered is the address used for tax reporting purposes. So please confirm that as well with your financial office before entering data here, because missing or incomplete information can cause agreement delays. Next slide. The remit address is where payments will be mailed. Please confirm with your financial office before entering the information there. If there is missing or inaccurate information here, it may result in lost or delayed disbursements. So I'm going to get that right. Next slide. The next application page is the program description page. Here you'll just briefly describe how your program meets the Song Brown goals that we covered on page 3 of the TA guide. Next slide. The next application page is the program data page. It's critical that you make the correct selection here for the reporting question. The wrong selection can send you down the wrong application path and will impact your score and may prevent you from receiving an award opportunity. Next slide. Select yes to the import question only if you completed an RN application last cycle. Otherwise, select no. If you applied last cycle and followed the instructions on the previous pages, yet your import didn't work for some reason, just go ahead and email us at songbrown@hci.gov and we can walk you through it. Next slide. Okay. The next application page is the training sites page. If you applied last cycle and you had selected import, your training sites from last application will appear here. Just follow the instructions to review your imported sites. And note that records must reflect on the no errors list before you're able to move forward in the application. Next slide. To add a new training site, follow the instructions here. Note that clinical training sites in registered nurse shortage areas is a part of scoring criteria. Site records with errors may not be considered for scoring. Next slide. To edit or delete a training site, just follow the instructions here. Next slide. The next application page is the program expenditures page. Follow the instructions here to enter your annual expenditures, as well as the requested number of slots you're seeking support for. If you selected no to the expansion question, you will see a field to request existing slots. If you selected yes to the expansion question, you'll see a field to request existing slots, as well as a field to request expansion slots. And on the slot requests, programs can request support for first-year filled slots only for both existing and expanding programs. And just a note on the true expansion. Expansion slots are those approved by BRN within an expansion letter that reflects slots beyond existing slots approved and filled. For example, if a program is approved for 40 slots and fills all 40 slots and is subsequently approved to expand by 10 slots, the program would qualify to request 10 expansion slots on this page of the application. However, if a program is approved for 40 slots yet only enrolls 35, they cannot request expansion funding for the remaining 5 slots, as that's not a true expansion. Next slide. The next application page is the student data page. You will only see this page if you selected student data to report early in the application. If you applied last cycle and you selected yes to import, your student data from last application should reflect on this page. You just want to follow the instructions here to enter and review student information. And please note that student records must reflect on the no errors list before you're able to move forward in the application. Next slide. Follow the instructions to add new students here. Students underrepresented in medicine is part of scoring criteria. Please see the Song Brown glossary for the underrepresented categories that qualify for Song Brown. And note that student records with errors may not be considered for scoring. Next slide. You can follow the instructions here to edit or delete your student information. Next slide. Okay, the next application page is the graduate data page. You'll only see this page if you elected to report graduate data earlier in the application. If you applied last cycle and you selected import, your graduate data from last application should appear here on this page. Follow the instructions to enter and review graduate information, and note that records must reflect on the no errors list in order to move forward in the application. Next slide. Follow the instructions here to add new graduate information. Graduates underrepresented in medicine is part of scoring criteria. Please see the glossary for the underrepresented categories. And note that graduate records with errors may not be considered for scoring. Next slide. Okay, so follow the instructions here to add graduate practice site information. Graduate practice sites in registered nurse shortage areas is part of scoring criteria, and you can refer to the grant guide and the scoring guide for more information. And same here, the graduate records with errors may not be considered for scoring. Next slide. Follow the instructions here if you don't have practice site information for a graduate. Next slide. Okay, so at this point in your application process, most of your data entry has been done, and you'll want to review the common application errors on this page and the next page against your application to resolve any data entry issues before submitting your application. So it's if you go forward 2 slides. Yeah, to required documents. So the next application page is the required documents page. The attachments here should reflect the full story of what your program was approved for as far as existing program, as well as what you were recently approved for to expand, if that applies. If you selected no to the expansion question earlier in the application, you're just going to attach the most recent letter from the BRN noting the number of students your existing program is approved for. And if you selected yes to the expansion question, you'll also attach the BRN approval letter noting the number of slots approved related to expansion. Next slide. The last application page is the assurances page. Once you are ready to submit your application, follow the instructions on this page to submit, and note that only program directors can submit the application. Next slide. Once the program director clicks submit, this message will appear confirming submission. Next slide. And here's just some post-submission maintenance. You want to follow the instructions here to maintain your application information after submission. And please email songbrown@hci.ca.gov when there are changes to the information that you've submitted in your application, such as contact information. If contacts listed in the application are not maintained, you might miss important communications regarding RN grants. Next slide. You can follow these instructions to view and print your application if you like. Next slide. And just a heads up on the subsequent process. If you receive an award this cycle, agreement signature will occur through DocuSign. We can't accept other forms of signature. It has to be the DocuSign. And there's further detail about that DocuSign process on this slide, the next slide, so we can advance 2 slides. And then I'll hand it back over to Chris.
All right, thank you, Crystal. As you can see, your team has put a lot of hard work into this program, and we're excited that you've joined us today to learn more. We're going to transition to our question and answer session, and at the chat option has been open. We will answer questions in the order that they are received, and we'll do our best to order all of the questions you have today. And so go ahead and start asking any questions you have, put them in the chat, and we'll be able to answer them. If you haven't seen yet, we've also posted the links to the chat box as well. And let's make sure that that's pinned to the top here. There we go. You can find that as well. Any questions today for the program? As we mentioned earlier, we will be providing a recording of this video in about 7 to 10 days. We also have the slide deck available on our website right now. All right, first question. So if we had an approval for 40 students in 2016, but we only expand from 20 to 40, we are not eligible for expansion, correct? That's based on 2023.
Melissa, did you want me to? Okay, go ahead.
Hi, everyone. This is Melissa Almond. I'm the Song Brown program manager. That would be correct. You are not eligible for expansion this cycle, application cycle.
All right, thank you, Melissa. Next next question. Let's see where to go. Are we able to print the application?
Yes, and it's about 4 slides back, the instructions, but I would say see the TA guide, but yeah, it's really simple to do that. There we go. Post, let's see here. There you go.
There we are. All right, thank you, Crystal. Thank you, Alma, for pulling that slide up. Stephanie asks, if there are errors with previous graduate submissions, how do we correct this?
I believe you're referring to when you do the import feature and you're reviewing and you're like, hey, some of these imported graduate records are, maybe they're missing something, or maybe they didn't get entered correctly last time. So there are instructions on the TA guide about how you edit and delete records. So I would just say follow that process.
All right, thank you. Next question. We had an approval visit in spring 2023. We have not received a formal letter about approval, but informally received continued approval. Should I submit the existing letter if not received the update letter for this approval?
Thank you, Mary. We've been receiving a lot of those questions today, and we can work with you after this to see what you have now and keep in touch about what you're going to get in the future as well, as far as letters.
Can I add on to that? Can I add on to that? So I think that if what you have is the your current letter, right? You said that you're waiting for your newer letter from your visit that took place in 2023. I think that we would go ahead and accept that, but if you could please provide us with an email and a copy of that letter just so that we could take a look at it. I don't think that there's going to be any issues, but I just want to see what the take a look at the letter before we definitively say yes that we'll accept this older letter.
All right, thank you. Next question along similar lines. Beth says, I'm waiting for an approval letter from the BRN for increased enrollment of 34 students, but don't expect it until 11/22.
I don't see a problem with that. The important part is the service term of the agreement is June 30th, 2024 through June 30th, 2026. Those are for sure the dates of service. So it sounds like you're going to get your approval far before then. But can we also, same as what Melissa was saying, can we just work with you maybe after this to see what documentation you have right now and make a plan for when we can expect the remaining documents?
All right, yeah, Beth, so go ahead and, yeah, thank you. Go ahead and email us. All right, Evangeline asks, what qualifies for expansion?
There is a slide back on expenditures that kind of briefly describes what a true expansion is. And so for the existing award, it's a maximum of 30. And if you qualify for expansion, it's a maximum of 10 slots. So I would say see the example on the expenditure page. Let's see here. 35 is slide 35. There you go. So here is where you will enter up to 30 existing, up to 10 expansion, and Evangeline, yes. So I reached out a couple times today, and we'll definitely circle back to your program and those particular that particular case soon.
Crystal, do you want to give your example again of what
Sure.
qualifies for a true expansion of a program?
Sure. Okay, I'm pulling it up. Okay, so here, I can also put it, I'm going to paste it in the chat as well. There's a couple examples in here about what is and isn't a true expansion. So expansion slots are those approved by the BRN with an expansion letter that reflects slots beyond existing slots, both approved and filled. So if your program has 40 slots that were existing and those have been filled, and then you're subsequently approved to expand by, say, 10 slots, then you would qualify to request those 10 expansion slots on this expenditure page of the application. But if the program has been approved for 10 existing slots and they haven't met that yet, they will say they've only enrolled 35, then they wouldn't be able to request expansion funding for those remaining 5 slots because that's not a true expansion.
Right. Thank you, Crystal.
Welcome.
Next question, when will this recording be made available? We try to get this posted within 7 to 10 business days on our website, and then we email that out to the list of people who registered for attendance. Next question, is expansion only for BSN or is the CEP included for expansion?
Melissa, I'm not sure. Do you want to take that one?
Can Evangeline, can you tell me what CEP stands for, please? Because I mean, I will say that the expansion is only for the BSN program, right? It's for the pre-licensure programs, right? So the ADN, BSN, or ELM programs that we currently support through RN, if one of those programs is expanding, then then they can request expansion funding if they're eligible.
Okay, so I see Evangeline and Christina are kind of jumping onto the same line of question, and we get this often, which is the concurrent enrollment. So in those circumstances where you have like junior college, for example, students that have not yet completed their junior college program, but they may have like 1 foot into a UC or CSU program, we're going to ask that the community college apply for an award for those students that are still in a junior college and have not yet completed. So we wouldn't double count, right? So like we wouldn't count those specific students for both the junior college and the CSU, for example.
Correct.
All right, let's see. Next question, how far back do we need to provide data regarding job placements?
I'm unsure of the question. Do you mean how long are you having to track your graduates? Because because we're only asking for reporting on very specific academic years of graduates, and that's in the application. It's only 2 years. I can pull those up if you want to, if that gets to the point of the question there. I'm just pulling up the graduate page.
I think the 2 years was the answer that Tisha was looking for.
Okay, so it's on page 38. So this year you're going to be reporting on academic year 1920 and 2021 graduates.
All right. Okay, let's see here. Next question. What if the ADN program does not apply? Can the CSU apply?
I would first like to just say that if they have not yet graduated from their junior college, and that's where the majority of their work is, like they haven't progressed on to like, then obviously like the community college level would take that. And then I would also like to look into, at that point, does the CSU have a BRN approval letter specific to the program that's housed at their site? So if you have a letter maybe for your CSU program, I would say let's touch bases after this and take a look.
All right, sounds good. All right, any other questions out there today? These have been great questions, and all of these questions help us make sure that our grant guides and our webinars are answering the questions that you guys have. So we appreciate your participation with us today.
Chris, somebody asked, what about masters? And so we do fund entry-level master's programs. And so an entry-level master's program would be eligible for both funding opportunities.
All right, thank you, Melissa.
Mm-hmm.
Any other questions today? Again, you can find all of the resources pinned to the top of the chat board. You can find resources on our website as well. And if you have additional questions, you can email the team at songbrown@hci.ca.gov. It's like we're coming to the end of the question time. So thank you all for participating in our Q&A session. If you have more questions, again, please email the team. As a reminder, we will post, oh, we got another question here. Do we add only graduate data for the RNSA field or all?
When you open up a graduate record, everything that's a required field will have the red asterisks. So yeah, you'll the practice site, that is a required field, and anything else on that window. I hope that answered it.
Can I add to that? So yeah, you would be required to provide us the graduate data for all of your graduates for the year that we're requesting. So, you know, we're looking for a name, their current practice site location, the year that they graduated. We're not only looking for you to provide graduates that are located in an RNSA. We need all of your graduates.
Yeah, that's what he clarified to say. Are we being exclusive to the URM student? Nope, it's everybody.
Yeah. No, it's everybody. Yeah.
All right. Great question, and thank you for the answer there. Again, as a reminder, we will post the recording in 7 to 10 business days. The slide deck is on our webpage. We appreciate everybody joining us today to learn more about Song Brown Registered Nurse Education Program Grant. We're excited to be able to offer it as a part of our health workforce development efforts at HCAI and are grateful for your participation with us today. We encourage you to go to our website to discover all the great resources that HCAI offers. As a reminder, early submission reviews are due November 14th, and the application cycle closes November 28th. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.
Thank you.
Thank you.